In Papua New Guinea, we have an estimate of 850 individual local languages. The first archaeological finding up in Western Highlands province found evidence of people living in Papua New Guinea 50,000 years ago. My name is Jesse Irie. I am from the Eagle clan and the Cockatoo clan here in Papua New Guinea.
My name is Esther Silas. I come from Eastern Highlands.
The name Touching the Untouchables, in short TTU, came from Esther. The untouchables are those communities where health services are not reaching them. These are the ones that continue to be left behind and they're dying.
When I first started work, it was in 2000. I worked as a nurse in one of the rural health facilities. And when conducting maternal and child health clinics from one village to another, that's when I saw the need of isolated communities who has been left out from basic services. So that's when the idea came about to start an NGO that can bridge those gaps. And I decided I should come up with a program that should empower individuals to take ownership of their own health.
TTU was founded purposely to deliver the best health services to the people living in rural and disadvantaged communities of Papua New Guinea. The health services and the care that is needed in the communities can be done better, and we can do it better. We will give you your job descriptions. You will have your terms of reference, and you will have the policies. But we are from here. Touching the Untouchables, since its inception until now, we have worked in more than 2,000 to 2,500 tribal communities in Papua New Guinea. And when you treat them the way that they should be treated, how will they respond to you? Yes, they respond positively. Let's give him 3 big claps after 3. 2, 3.
So now with our hands and feet and our whole body, we said, together we can.
Yes.
So we'll get a 1, 2, 3.
Together we can.
Thank you. We know the cultural beliefs and also the approaches that can change the community.
One of the beliefs is in Sanguma, is in witchcraft, sorcery, and poison men and poison women. They are used interchangeably.
Sorcery and Sanguma beliefs are deeply rooted in our cultural beliefs. So everyone, whoever family member dies or somebody else in the community dies of a disease or a sickness, everyone still blames or says it's an attack from the Sanguma or a sorcery because of our cultural beliefs. And only few knew that it's because of the sickness or illness. Sangoma is directly related to gender-based violence because in Sangoma cases, most women are being accused. Most of the mothers and women in the community, their life is at risk when they are being accused because they knew that if anyone dies in the community, then they might lose their life. They might also die. We don't need to get rid of the beliefs, but it depends on individuals how they manage the beliefs. If you want to change the community, you have to work with the leaders. And when whatever the leader says, the rest follows. This is
Kintunu village.
Kintunu village. This is where we will be whole day. There is a workshop or an approach that we use in the community, and it's called CommunityLed Total Sanitation, and it addresses all the preventable diseases and even the hygiene and sanitation facilities in the community.
Fly trap. You can use mosquito net.
After the training, to check their understanding, we ask participants for their feedback, and most participants' feedback is we can be able to prevent ourselves from getting sick rather than accusing Sangoma and sorcerers, saying that we are dying because of the Sangoma. Nalo back side, Narapa side. 1, 2, 3, 4, 5. 1, 2, 3, 4. Through the sessions, the community realized that they can be able to prevent most of the diseases by creating simple things like hand washing stations, beautifying their place, and building drains in the community. So when they realize that they can do it themselves, it motivates them to take action.
For me, there's in my heart there's a cry for peace, for reconciliation, for someone to bring that lasting peace.
I have seen most communities who was involved in sorcery and Sanguma accusation before we enter the community has changed. So this is the basket for the whole family. And the mothers are preparing for the family to go into the We want everything to be, all the programs to be bottom up and also top down. Community to take ownership of all the programs that we are delivering in the community, and also make sure that it is also strengthened by the existing system, top down from the government down. We don't see this happening in other organizations. We believe in PNG ways, and we want to do it our ways, even though it is very difficult. The work that we did under this organization has saved a lot of lives, especially the mother and babies in the remote and isolated or underprivileged communities.
What the people are doing here is a model to the 3 villages. We have 1 village up there, and we have another village down there. So this community will become a model village, so the people can take it on from here. And we can all strive for a change in our own community. Titi, you showed your love for us, and thank you for everything. We have seen your work. You have done some marvelous job around the place, so thank you very much for your coming here. So Titi, we acknowledge you. Bless you. Thank you.
The communities and the districts that we have touched, they are doing something productive, and they are looking for ways that they can do something better for their community and for their country.